In this video by Deck Plate, we will understand the VA disability ratings for eye conditions: loss of eyebrows, complete, unilateral or bilateral; loss of eyelashes, complete, unilateral or bilateral; disorders of the lacrimal apparatus, epiphora, dacryocystitis, etc.; optic neuropathy, cataract, aphakia, or dislocation of crystalline lens; paralysis of accommodation, due to neuropathy of the oculomotor nerve, third cranial nerve; loss of eyelids, partial or complete; Pterygium, Keratoconus. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. The VA provides disability ratings for various eye conditions based on the level of visual impairment or other symptoms experienced by the veteran. Each condition is rated under the general rating formula for eye conditions. Here's a breakdown of the ratings based on incapacitating episodes. 60%, with documented incapacitating episodes requiring 7 or more treatment visits for an eye condition during the past 12 months. 40%, with documented incapacitating episodes requiring 5 to 6 treatment visits for an eye condition during the past 12 months. 20%, with documented incapacitating episodes requiring 3 to 4 treatment visits for an eye condition during the past 12 months. 10%, with documented incapacitating episodes requiring 1 to 2 treatment visits for an eye condition during the past 12 months. Specific eye conditions and VA diagnostic codes: loss of eyebrows, complete, unilateral or bilateral, diagnostic code 6023. A complete loss of eyebrows, either unilateral or bilateral, can result in a VA disability rating of 10%. Loss of eyelashes, complete, unilateral or bilateral, diagnostic code 6024. Complete loss of eyelashes in one or both eyes also warrants a 10% disability rating. Disorders of the lacrimal apparatus, epiphora, dacryocystitis, etc., diagnostic code 6025. These disorders affect tear production and drainage, leading to issues like watery eyes or infections. The VA assigns a 20% rating for bilateral conditions and 10% for unilateral ones. Optic neuropathy. Diagnostic code 6026. Optic neuropathy involves damage to the optic nerve, which affects vision. Ratings are determined based on visual impairment under the general rating formula for diseases of the eye. Cataract. Diagnostic code 6027. Preoperative, rated under the general rating formula for visual impairment. Postoperative. If a replacement lens pseudophakia is present, it's evaluated under the general rating formula. If there's no replacement lens, it's rated based on Aphakia, diagnostic code 6029. Aphakia, or dislocation of the crystalline lens, diagnostic code 6029. Aphakia refers to the absence of the eye's natural lens, usually after cataract surgery. It is evaluated based on visual impairment, with a minimum rating of 30% for unilateral or bilateral cases. The impairment level is elevated by 1 step. Paralysis of accommodation, due to neuropathy of the oculomotor nerve or third cranial nerve. Diagnostic code 6030. This condition causes difficulty focusing on objects at different distances and is assigned a disability rating of 20%. Loss of eyelids, partial or complete, diagnostic code 6032. Loss of eyelids can cause both visual and non-visual impairment, such as disfigurement. Ratings are combined based on both impairments. Pterygium. Diagnostic code 6034. Pterygium is a growth of tissue on the conjunctiva. It is evaluated under the general rating formula for visual impairment, disfigurement, diagnostic code 7800, or conjunctivitis. Diagnostic code 6018. Depending on the specific symptoms, and combine in accordance with section 4.25. Keratoconus. Diagnostic code 6035. Keratoconus is a progressive thinning of the cornea that can result in distorted vision. The VA evaluates it based on the degree of visual impairment under the general rating formula for diseases of the eye. Thank you for watching this video. Please don't forget to subscribe and like our videos.